side feel tighter?
It does.
Which one's tighter, left or right? That looks tighter.
Yeah,
that looks tighter, right? I usually give all my players a pre-assessment so that it's not me going, hey, that looks better. I want them to go, no, that feels better. I want confirmation as well. I think that's a cool one where they can't cheat. This position here locks out the lower back. It's all thorax. It either gets better or doesn't. Right? So now, quick assessment. Go ahead and lay on your back. So first thing I do, assessment-wise, is remember I told you I don't know what the problem is. If it's fascia, if it's ribs, if it's spines, or the attack is. I take my hands and I literally check, holy shit, I check rib cage, see if the rib cage is pliable, right? And I basically just kind of go side to side like this. You thorax flexible? Lay down right here. No stooning, lay down right here. 2 seconds, hands down, until it relax. Look at this. Wait, see that spine right there? What the? I can't bring movement. Sorry. Right? You see how different that was? Right? So basically, it should be pliable. It's like an accordion. You should go spring in and out. And this is like, there's no way you're going to tell me the rib cage is not involved. Okay, that's massive. Then what I do is I say, okay, I know we got to look at rib cage. So if this is a problem, I take my hand right on the sternum, hands down by your side. Take a big breath in for me. And I'm out. Take your breath in for me one more time. And what I like to see is, make sure the rib cage is expanding. I call this the landing strip. Put your mind on the gutter. I go, take a big breath in. This is an airplane. It should take off. And then as it breathes out, it should land. I don't see a lot of excursion going on here. Just see some layers that goes up. And not talking about diaphragmatic breathing. I'm talking about excursion of the rib cage. So the rib cage should be going up and down. Just restricted all over the place. So rib cage is on my list. Well, I'll show you how I attack rib cage in a second. Sit over on that chair for a second. I'm talking a lot to my picture here, coaches, so sit facing that way. Okay, now a little bit closer to this so you're away from the side there. Okay, just like that. And what I'll do is, just so you know, palpation-wise, I take his arms, cross his arms over his shoulders, arms across your shoulders, and arms just tell him relax. Good. I'll basically take my hands to this side. Can I kill this?
Yeah, we don't need that. You're okay.
You're going to want me to kill the other one too.
Yeah, you kill that other top. Okay. So, what I do is I take a wide base with my hands. I put my hands right across the oblique fascial chains over here. Like, nothing specific, just nice wide base. I say, go ahead and turn to the right, and back, and turn to the left. Now, what I do is I use him and I use me, and I say to this, I say to my player, I go, okay, when you turn to the right, there's some muscles over here that contract. When you turn to the right, there's also muscles on the left side that contract. Go ahead and turn to the right. You feel these muscles here, and you feel these muscles here.
Feel about equal to me.
Okay, now we're going to go left. You should feel the same thing. There's one's on the left, one's on the right. What do you feel there?
Feel equal.
Okay, when you turn.
When I put either way, I don't feel one stronger than the other.
How about when you turn right versus left? They both feel the same, symmetrical, right?
To me.
Okay, and over here to the left. And now I always ask him that if a player says, "Man, those feel totally different. Like I feel something pulling over here when I turn right, and I feel nothing over here when I turn left." Trust me, there's an oblique fascial problem, right? Their perception on this is incredible if there's a problem, but even if they say it's okay, I still palpate to see if I feel anything different. So I literally put my hand, you might be able to feel it on yourself just turning, but it's easier sitting down, having somebody grab your love handles. Now if I say go ahead and turn to the right, I kind of go, how much does he push in here, how much does he push in here, and I come back to center and I say go left. And honestly, I don't feel what I normally feel on which is surprising. I thought the oblique fascia would be a big problem. A lot of times you'll feel like, wow, this is tugging and this isn't. I kind of agree with him. I don't feel a big difference between left and right. 70% of the people you see are going to go, no, that feels totally different. Like this, something's pulling over here, something's over here, and then you have to add the fascial lines or dry needling, or if you guys are into that or anything, to try and release some of these things to make a huge difference. Okay, then last thing I do, I'm just still testing, and I'll show you my exercises. Take hands like this, forehead just like this. I say you totally relax. Now I'm going to check his spine. And I basically just do a motion palpation. I go up and down his spine, trying to see if anything feels restricted. Like down here, I'm like, that actually feels pretty good. That feels pretty good. A little tight in there. Dude, the worst thing on you by far is your rib cage. Do you agree?
I would say so.
Like, holy crap, the rib cage doesn't, but the spine's actually moving, and the legs moving. So we're doing rib cage on your back. So here's how we do this. And then I'll show you some fascial ones and some spine ones anyway. It's for you guys. You guys are all going to fall in different buckets. Okay. And if you want to do this with us, find a space, get down, do your little test, pre-test, and then we can do it together. And you can see, you can freak out, or you can just watch. So you want to do a little pre-test, and you're going to do it first. Okay, anybody wants to do the pre-test, do it, and then you're going to follow me with the exercise. Give yourself a pre-test. Yeah, it's better than just standing there, right? Might as well do it with us. Sit back to your heels, forearms together. Sit back on your heels, forearms together. Put your right hand behind your back. Look to the right and raise your right shoulder to the sky. And then do the one on the left. Look to the left and raise your shoulder to the sky. That's your pre. Now when we're done doing the exercise, you're going to retest. If it feels better, you need to add these exercises. If it doesn't help, we don't add. This is how we figure out which exercises they should do. We always do the exercise now and we retest. If it makes it better, it adds to their list. If it didn't change, we don't add to their list. We get rid of that exercise. Okay, so first exercise we're going to do. Everybody lay on your back. Lay on your back. This is going to sound stupid. On your back. When the rib cage is restricted, the thing that gives the biggest bang for the buck is distraction. Distracting the rib cage, the joints, makes the biggest bang for the buck, right? How do you distract the rib cage? Breathing is the only way I know for you to distract the rib cage here. So forget about what you've learned about normal breathing. Like I'm not talking about normal back breathing. I want you to try and distract. I want you to expand your rib cage more than you've ever expanded in your life. Now your rib cage does this. Those old-fashioned pumps, like there's a pump handle. This is what your rib cage usually pumps. Like the top goes up and down like this. The sides is like we call a bucket handle, like the handles of a bucket. It goes out. So the sides go out and the front and back go this way. That's how your rib cage expands. So watch what I'm going to do with Brian real quick. I'm going to say, okay, Brian, imagine this is the pump handle. I want you to take a big breath in as much as you ever have for it and lift my hand up. My hand didn't even move. And back down. Now lift my hand up again. Come on, higher. Push it up here. So this is going up this way, and then all the way down. And lower the pump handle down. And more. I need more. Good. And then down. Okay, everybody do that one first. Let's do it. Lay on your back. Raise the pump handle up as high as you can. More than you ever have in your life. Put it high on the sternum. Not in the middle of the sternum, up more towards, yep. Good. Keep going, like two more. And by the way, if you feel lightheaded because you're breathing, that's a good thing. You don't even need any of those drugs. Just keep taking a big breath in and the rib cage. Okay, now, after you've done 3 of those, watch what I'm going to do with Brian. I take my hands, I put it on the sides of the rib cage. I said, now we're going to work on the bucket handle. I want you to expand laterally, so push my hands out. And out. So you're going to breathe in through your nose this time. Breathe in through your nose and push my hands out. And it's so hard for him. It's like everything else is going, he's trying to figure out how to move his rib cage. Yeah. I'll let him keep going. We'll do 3 of those. Try and expand the lateral parts of your rib cage. Promise we're coming to the exercise in a second. This is warm up. This is getting the rib cage moving.
I'm squeezing my butts too, Rick.
You're just trying to figure out, because the rib cage doesn't want to move, you're trying to figure out anything can happen. You're just trying to expand, get more oxygen in your lungs. Okay, now watch. I'm going to have Brian lay on his right side. So he lays on his right side. Now what I do is, I didn't see anything really happening with bucket handle or pump. I take my hands on top of him. I put my hands on here, and I say, it's like, I call this rib CPR. I put my hands on his ribs. I'm not really pushing at all. I say, go ahead, Brian, lift me up. Big breath in. Good. There's some excursion. And breathe out. All the way out. Let it sink. Big breath in through your nose. All the way out through your mouth.
Greg, what level of pressure are you putting on him?
Not much.
Like 10%?
I'm not breaking any ribs.
Walk out, yeah.
I'm just giving him a little, go on your side. Let's do it on your side. Lift yourself up. Turn the other way. I know this thing's stupid, but some people are going to get 20 degrees just doing this. Big breath in. In and out. Big breath in. You can lay a little sandbag on your side, lift it up in the gym. Big breath in. All right, this one's not good. You notice that?
Yeah, I think it's
So right side on Brian's much harder here, so I would actually have him double this down. And big breath. And. Okay, now after we're done doing that, a lot of times what we'll do is we'll actually have them go face down. Have them go face down. Hands are down by your side. I heard this carpet smells awesome. And basically what I do is I'll put my hands on here and I'll say lift me up. Big breath in. We'll even do anterior breath. We're just trying to sound like he's had a heart attack. Big breath in and out. Okay, go to your lumbar lock position. So go to your hands and knees, sitting back, forearms. Put your right hand on your back, and you're going to rotate to the right. And we're going to compare right and left just to see, hey, does just distracting the rib cage do anything? Let's go left. Compare yours if you just did that breathing and see if it makes any. Did that make any difference to you, Brian?
Yeah.
Okay, so Brian's going already. He's like, wow, that's actually already helping.
For my left side, yeah.
We haven't done shit yet. All we did was just breathe. Okay. Okay. Now, how many of you have noticed the difference already just by breathing? Okay, that's crazy. Now, here's what that means: is every exercise we do from this point forward, guess what we're going to do? We're going to distract the hell out of your rib cage. Okay, so now what I'm going to do is I'm going to put your ribs into some positions where you're really not going to like me, and we're going to try and distract these things out. Okay, so let's all do one of these together. We're going to go. We lock out the other parts of the body in all different positions for fascia. This is a very common fascial position. Most of the fascial seminars, workshops you go to, you'll see this hip 90-90 position. So let's go right leg forward. Let's go right leg forward so I can speak the same language. Okay, right leg forward, and basically, by the way, you're going to be like out here, so make sure you're not hitting anybody off your right. Make sure you're okay, so watch me first. Okay, laser beam coming out of my chest. Laser beam coming out of my chest is right out my right femur, pointing straight forward. My shoulders are perpendicular to my right femur. Here's the problem. That's backwards. I want my shoulders parallel and my laser beam perpendicular, so I'm going to turn to the right. Put my forearms over so my shoulders are parallel with my right femur. Forearms are down on the ground. Now for you guys with rib cage issues, you're probably already starting to feel your rib cage block here. Now from this position, Brian, what do I want you to do? Stay there. What do I want you to do, Brian?
Yeah.
Big breath in. Expand the bucket handle and the pump handle as high as you can, and try and drop your left shoulder as you breathe out. Build your rib cage more than you've ever had before. And breathe out. One more. Big breath in. 3 big breaths. And breathe out. Now we're going to stay in this position. Right forearm stays right where it is. You're going to take your left hand. You're going to reach out in front of you. Get your hand off the ground. Extend your elbow. Try and keep your left shoulder low. Hands off the ground. And you're going to expand the rib cage. Big breath in. Now you just locked your spiral fascia on top of this. Big breath in. Expand that rib cage. Try and drop this left shoulder. Keep that back leg on the ground. Big breath in. Expand the rib cage. Breathe out and try and drop the shoulder. Now after you've done that twice, you're out here. Now what you're going to do is you're going to take both hands back up here, elbows locked. You're still out to the right. Put both hands up like this. Now we're going to slide all the way out.
Breathing out. Slide
We're
out.
going to basically, hands just slide out this way. Nose goes down to the floor. You're going to try and reach as far away from you as possible. Keep your legs on the ground. Take your legs towards your feet, take your hands towards your head, try and separate yourself in half and take huge breaths. So you're going to take, your legs are trying to push away from your butt, your hands are trying to push away from your head. So basically you're doing it right. And this here you're trying to stretch this way and stretch this way. Try to tear yourself in half. Big breath in. Everybody feels this in a different place. Okay, and now watch, come back up. Let's go back up into our lumbar, it's called lumbar lock test. Put hands and knees. We just did right rotation. Right hand behind your back. Rotate to the right.
This is the one that's getting out.
Good. Get an idea what that's looking like. Now we're going to go get the left side. Let's compare. Left leg in front.
Right side?
That was for right side. Yeah, that we just did right.